Hello everyone, I'm Alex Coulter, Director of Arts and Health Southwest and Project Manager for Creative Health. I'm recording this presentation in my home in Oxford, and as many of you will be, I am working from home during the current crisis. I hope you're all keeping well, and a particular thanks to any of you who are working in key services. Thank you very much to Alex Mermakides and Sarah Donetto for inviting me to contribute to this symposium and for enabling us to connect and share today. I'm sorry not to meet you all face to face, but hope that the important conversation that this symposium is addressing can continue in the months ahead, and that we will have an opportunity to discuss it in person in the future. Arts and Health Southwest is a learning, advocacy, networking and development organisation, and we believe that creativity is at the heart of human flourishing. We represent the Southwest region on the Culture, Health and Wellbeing Alliance, a national network for everyone who believes that cultural engagement can transform our health and wellbeing. In these troubling times, we are all trying hard to support each other and to develop ways to connect with those who we might usually work with face to face. There are many resources for practitioners and organisations to help with information and ideas during this period. You can find them on the Culture, Health and Wellbeing website, and the list is being updated daily. I hope that you can all see this slide presentation and that the recording is clear. In my work for the All-Party Parliamentary Group on Arts, Health and Wellbeing, the APPG, I project managed the national inquiry which led to the publication of Creative Health, the Arts for Health and Wellbeing. Recommendation 8 in the report is, we recommend that the education of clinicians, public health specialists and other healthcare professionals includes accredited modules on the evidence base and practical use of the arts for health and wellbeing outcomes. We also recommend that arts education institutions initiate undergraduate and postgraduate courses and professional development modules dedicated to the contribution of the arts to health and wellbeing. The recommendation doesn't highlight the potential for interdisciplinary work within higher education institutions between arts faculties and medical and other health education departments, or collaborations between educationalists, as we are seeing here in this symposium. It seems to me this is one of the most effective ways that we could develop understanding and expertise through collaboration. In the introduction to the report, Lord Howarth of Newport, co-chair of the APPG, writes that we offer a challenge to habitual thinking and ask for new collaborations to be formed across conventional boundaries. Culture change is the real challenge. An intangible shift in awareness and understanding across multiple sectors and at every level, from grassroots to government and everything in between. This infographic from the Creative Health Report gives an indication of the range of research, policy and practice areas that we might be considering. Policy can support culture change as well as be shaped through culture change, but new policies landing on stony ground will falter. Creative Health landed on fertile territory and is part of a growing movement to transform the health and care system from a hospital-centred and illness-based system to a person-centred and health-based system to support a healthy and health-creating society, in the words of Nigel Crisp and colleagues. Education is key in this cycle of change. Since the publication of the Creative Health Report in 2017, progress has been made across all areas in the 10 recommendations. With regards to Recommendation 8, I have been part of conversations and events that indicate an increased focus on arts and health in higher education, including the establishment of a new research centre on arts and wellbeing at Edge Hill University, the Illustrating Mental Health Conference at Worcester University, a new Masters in Arts and Science, a MASC on Creative Health being established at University College London, cross-departmental collaboration at the University of East Anglia between Norwich Medical School and the Arts and Humanities faculties, just to name a few. However, we are nowhere near systemic change, and we are still dependent on champions and passionate advocates to make things happen. I'm not aware of so much activity within nursing and midwifery education, so this symposium is particularly welcome. I see the vision of creative health and of the soon-to-be established National Centre for Creative Health, recommendation 1 in the Creative Health Report, as helping create the conditions in which arts and creativity can be mainstreamed in health and care delivery, supporting healthcare professionals to be creative, as well as to enable them to work with arts and cultural providers and practitioners to support health creation and a person-centred care. The wider context is, of course, the whole community and prevention of ill health across the life course. A huge agenda which has once again been thrown into sharp relief by the recent publication of Health Equity in England, the Marmot Review 10 years on. The current threats can only make inequality more stark and action more urgently needed. During the inquiry, we heard from over 300 people, including people with lived experience of ill health, healthcare professionals and commissioners, arts practitioners and organisations, policymakers and ministers, academics and educators, amongst others. Roundtable discussions continued beyond the publication of the report to focus on the 10 recommendations. Some of the people contributing to Performance for Care were part of these discussions, including Susie Wilson, Director of Performing Medicine, and Kirsten Baker, Senior Lecturer in Midwifery at Oxbrookes University. Many nuggets of gold were gifted to us in those discussions. Kirsten called for us to move from certainty to wonderment, embracing the potential for risk and imagination in healthcare training and education. I have found amongst all the passionate converts I have met such an appetite for creativity and new ways of thinking about health and healthcare education. It's the people on the periphery of our circles of influence that we now need to draw in order to grow this movement for change. I'm interested in systems change and how we work collectively across multiple sectors and levels to influence change. Experiential and embodied processes are key, and performance and participatory creative activities are powerful tools in this collective endeavour. How can we ensure that people with lived experience of ill health are part of everything we do, from policy to planning, to delivery to evaluation, research and education? Back in 2013, at the first Culture, Health and Wellbeing International Conference in Bristol, one of our speakers, Dr. Yukimi Uchide, General Director of the Social Welfare Foundation Tenjin Kai in Ofunato, titled her speech, "From the Age of Care to the Age of Reciprocity." She talked about working with performance techniques to train her healthcare staff in looking after people with dementia, which is what you can see in this slide. She asked them to experience what it is to live with dementia and to move from a concept of caring for someone to living with them in a reciprocal relationship. In the Great Tsunami of 2011, which killed around 22,000 people, one of the care homes that Dr. Uchide was responsible for was very near the beach at the centre of the worst affected area. She talked eloquently about how the care home residents, with their embodied knowledge of the landscape surrounding the home, were able to lead the care workers to safety over the hills, and how there was a reversal of roles as they helped comfort traumatised younger members of the team. Following this, she redesigned a new care home and her staff training programs to reflect the equality and reciprocity of relationships that they had experienced together. The power of performance to build empathy and connection will be exemplified in the showcase of projects in Performance for Care. Careful, the collaborative project between the Guildhall School of Music and Drama and Kingston University, surfaces the reality that nurses also feel and the extraordinary tightrope they walk in giving compassionate care while sustaining their own emotional resilience. Student and staff audiences are drawn in to feel how it is to be cared for and are encouraged to experience the nuanced interplay of emotions in interactions between nurses and their patients. Just before this current crisis took hold, I spent a week in Dorset at our residential spring school with a small group of healthcare professionals, artists, academics, and people with long-term conditions. We spent time together exploring making meaning from illness through responding creatively to the natural environment. In this image, you can see me in the strange seal-like position and two of our participants around a beautiful pond full of the mysteries of life. This is a photograph of the pond from the mindfulness and photography activity we were doing. Two of our participants live with very life-limiting conditions, as well as being artists. They brought a sensibility to the group which was extraordinarily moving. They seem to act and speak with a greater truth and openness than is the norm in our everyday connections. It's hard to explain, but I wonder about the depths of human experience that illness brings, and the power of creativity to bring those experiences to the surface. A deeper connection, perhaps, between inside self and outside self. Grace and Perry gave us a quote for the Creative Health Report, which I often refer to because I think it captures some of this. Art helps us access and express parts of ourselves that are unavailable to other forms of human interaction. It flies below the radar, delivering nourishment for our soul and returning with stories from the unconscious. A world without art is an inhuman world. Making and consuming art lifts our spirits and keeps us sane. Art, like science and religion, helps us make meaning from our lives, and to make meaning is to make us feel better. Many of you listening will be specialists in performance or other art forms, in aspects of care or education. In my work, I need to take notice and recognise the importance and voice of many different specialisms and specialists in this truly complex and intersectional space. I find myself reaching out to people with lived experience of ill health who understand how creativity has helped their own health and well-being as a way of anchoring myself in the core purpose of the work. But so often we wear different hats at the same time. We are all patients in some way, and we can all be creative. A medical student who is working on theatre and medical education told us, "I'm passionate about this because my mum has a long-term chronic condition, so how I relate to patient suffering as a family member versus a future doctor is really important. We don't talk about the meaning of suffering because it can make us vulnerable. I'm currently resitting third year because my first time round my mum got very, very ill and I was unable to cope. But the one thing that kept me going was the Drama Society. The arts have a role in the imagination. Students find it really hard to acknowledge when they are suffering. The arts can help in assisting students themselves and for understanding the pain of their patients." Cracks, another one of the showcases in performance for care, a play written and directed by Tricia Jerram, a master's student of nursing at Edinburgh Napier University, shows how giving students access to creative activities can enable them to co-create and transform learning itself. It's very exciting to be witness to the energy and creativity of everyone involved in this symposium. I hope we can continue to build a coalition of the committed over the next few months to agree how to make further progress on this very important issue. Thank you.